something you simply wear, nor is it anything you envision it to be.
Honestly, I feel like when I look at the bottom of this outfit, the skirt, it reminds me of the office trash can.
It's body perfection. It's the art that defines who you are.
These kind of wedding gowns tell so much about someone's personality. I would wear something like this, to be honest.
You?
Yeah,
sure.
but literally with like a crop top inside.
When it comes to the red carpet, step back because we are here. You design it. You wear it. We critique it.
So how long did this take for you to put together?
This I bought from the States. It's $1.
How do I look?
Yeah, you look fantastic, babe. You look fantastic.
Tell me, what inspired your dress?
This, I think, was her wearing her own label.
I think she should have stayed home.
From your mind and body glam to your step out look, we define fashion as a lifestyle.
Thank you so much. What you guys are doing at Style Project is absolutely mwah. Say hi to Sheila and to my beautiful Bettina. Man, those girls are killing it.
We are the NTV Style Project.
You're watching Morning at NTV.
Good morning. We're back again. Apologies for that technical hitch. My name is Malaki Velodera. Thank you so much for choosing Morning at NTV. I told you we are on the hashtag Morning at NTV. That's on Twitter. You can also stream us live NTV Uganda. That's on Facebook and YouTube pages. So be sure to be part of this conversation. On Kickstarter, we always focus on politics, but today we have chosen to focus on a health topic, something that we don't speak about so often. And this is Hydrocephalus and Spina Bifida. Have you heard of those terms? So that's what we're going to be teaching you today. And in Uganda, 3 to 5 per 1,000 live births will be born with or acquire hydrocephalus, and about 1 out of 1,000 out of every 1,000 live births in Uganda will be born with Spina Bifida. So what are these terms and what does it mean? So in studios, I'm joined by Dr. Noah Matagala, who is a doctor with Cure Children's Hospital here in Uganda. Thank you so much for making time.
You're welcome.
What is hydrocephalus? What is Spina Bifida?
Hydrocephalus literally means an accumulation of water in the head. Normally we all have water in our heads, but there is a normal production, absorption in our head such that you have a constant volume. But hydrocephalus happens when there is an accumulation. You have excess water. Because of the excess water, it builds up and it will start producing pressure on your brain. In children, you'll see the head will start growing big because of the pressure that is building up. So that is hydrocephalus. Spina Bifida means you have a defect in your backbone. We have bones at our back that is one joined after the other. But then Spina Bifida, you have a defect in there, such that the contents that run in the middle of those bones, the spinal cord and its nerve roots, they can get out through that defect, and you have a swelling at your back.
Wow.
So that one is, a child will be born with it. For hydrocephalus, you can be born with it or you can acquire it. A child can be born, is fine, but as is growing up, they acquire it. And it is not only for children, meaning an adult can get hydrocephalus, meaning their normal system, the water can be moving, but something can happen, like we shall see, and your water starts not to move. In medicine, we call it cerebrospinal fluid.
Right.
It stops moving, then it accumulates in your head, then the pressure will build up.
But for Spina Bifida, you're born with it.
Spina Bifida, the defect happens in the early stages of formation of the fetus. Organogenesis, or the formation of forming organs of the body, happens in the first 1 month. So for you to have Spina Bifida, it has to happen in the first 28 days of the fetus being in the womb. So Spina Bifida is going to happen by the end of the first month of a mother being pregnant. So by the time a child is born, they have spina bifida because it happened in the first 1 month.
Okay, let's start with hydrocephalus. What are these triggering factors that lead to it?
Hydrocephalus can be either acquired in the womb, or you can get it when you're after birth. In our experience, we've realized that over 60% is acquired after birth, and among that 60% is coming from infection. We call it post-infectious hydrocephalus, meaning a child is born, but along the way they acquire infection that is going to go to the brain to affect the meninges. The meninges are the linings that cover the brain. When the meninges are infected later in life, this child is at risk of getting hydrocephalus. That infection is called meningitis. If it's poorly treated or it is not treated at all, this child has a higher chance of getting hydrocephalus. So the first trigger is post-infection, is after infection. So this child is born very well, but in one way or the other they get an infection, it is not treated, it goes to the meninges, they get infected, then it disorganizes the way the water is flowing in your head. Because the water is not flowing, it's going to accumulate. When it accumulates, then the head will be big and somebody will get hydrocephalus. But apart from infection, some people can be born with hydrocephalus. When you're born with hydrocephalus, there are very many things that can happen.
How come you're born with hydrocephalus? What exactly happens?
Okay, so in our head, like I said, we all have water.
Yes.
The water is in chambers that we call ventricles. We have 4 ventricles in our heads. So from one ventricle to another, there are connections, like small tubings that are connecting from one ventricle to another. So sometimes you may have a malformation per se, that in the process of formation there is a tube that got blocked
in the womb.
In the womb, yes. Yeah. Some of the things that we may not have control over. So it got blocked such that water is not able to flow very well. But the child is producing water. Because it is not flowing, it will just keep on accumulating. So there are quite of malformations that can happen in the womb. There are examples we call Dandy-Walker malformation. You can have a Chiari malformation. Sometimes you may have a stenosis, like I said. One of the tubes does not form, such that water is not flowing. But the other thing that we've talked about is spina bifida. There's a linkage between spina bifida and hydrocephalus.
Okay.
A child can be born with spina bifida, and they get hydrocephalus while in the womb. But also they can be born with spina bifida, the head is fine, but later in life they get hydrocephalus. So there's a linkage. So the brain is connected to the spinal cord. So it's a continuation from the brain. After the brain, you continue with the spinal cord. So that fluid that we are talking about in the head, the cerebrospinal fluid, is also continuous with the back. It covers the spinal cord. If you've had people that are sick, they do lumbar punctures to pick fluid from the back. So it is the same connection, the same continuation that goes from the head to the back. But these children with spina bifida, they have a kind of a malformation in their head that predisposes them to have hydrocephalus.
Wow.
Yes.
Let me ask you, you've said that some children get infections after being born,
yes,
and it can go to meningitis. If it's not treated on time, then the child gets hydrocephalus.
Yes.
But at what point can a parent or a mother sense that my child, by the way, has an infection? What are those telltale signs that we need to look out for?
Before we get to that, sorry, these infections can be in 3 stages.
Okay.
You can get the infection from the mother, in that as the mother is giving birth, they have an infection in their tract, the birth canal. In the process, the baby picks it. The baby can pick it in the process of delivery. For example, the hygienic condition wherever the mother is giving birth from is not good. There are mothers that are going to give birth from home. There are those that are going to give birth from the hospital but on the ground. So in the process, the child will pick infection. But then the third can be after birth. the mother is at home, the child picks infection, and they don't treat it well. But the things you're going to look at, these kids, the babies are going to have fevers. When they have fevers, high-grade fevers, instead of the mother running to the drug shop and buying Panadol, it's better to go to the hospital and investigate the cause of the fever and treat it. We have a common practice that when you get a fever, you go to get a Panadol syrup and it will calm down. The symptoms will go, but the cause will be still in. The other thing, these children, they will be very irritable. They are all crying, they fail to feed because they are always crying. So these are the things that when a child gets them, the mother should respond very fast. The child is having fevers, they're not feeding, they're over crying. It gets to extent that children get convulsions because of the high-grade fevers, and this should trigger the mother to go to the hospital, not to go to a drug shop to pick a drug that is going to calm down the symptoms.
So it's just fever and irritability.
So now these are the things that are going to show you the infections, not hydrocephalus.
Okay.
But when hydrocephalus are setting, then you're going to have some symptoms that are going to come from the accumulation of water and also from the pressure on the brain. Our heads have literally three things. They have the brain, they have water, that's cerebrospinal fluid, and they have blood. If the cerebrospinal fluid is increasing in volume, it means it's in the middle of brain.
Right.
So you have cerebrospinal fluid, you have brain, and you have the bone, the skull. So as it is increasing in size, it is going to press the brain on the bone. So you're going to have symptoms that are coming from increase in the volume, but also symptoms that are coming from the pressure on the brain. As the water is increasing, cerebrospinal fluid is increasing in volume, you're going to have, because the children, the head is not covered completely, so the head is going to grow in size. They are going to increase in size. Babies are born with what we call fontanelles. They have open spots on their head. Prominently, we can see the one in front and at the back. So as the head is growing in size, they are going to be bulging out because the fluid inside is pushing outwards.
Right.
So you're going to see the head is going to grow big. The soft spots are going to bulge out. They become harder and harder and harder, tense, because the fluid is building up. You're going to find these children, when you look at them critically, they have very prominent veins. Blood vessels are so prominent on their heads because of the pressure that is inside. So blood is not flowing very well inside. When you look at them critically, their eyes are going to be flowing in. We call it a sun setting sign, as if the sun is going down. So literally, for a normal person, you can see this black part and the white up and below. But then these children, because of the pressure up, the eyes are going to be as if they are falling in. So we call it a sun setting eye. So you're going to look at
But
it.
they still see.
They can see,
okay.
But you can see the mother will tell you, I only see the white thing. I don't know why. So it's because the pressure that is building up. Because of the pressure, these children are going to be vomiting. They're going to have seizures. They are going to be very irritable. Now it can give you irritability, or you're going to have a child who is very sleepy. The mother will tell you, my child is very dull.
Right.
They have to be woken up to breastfeed. As they're breastfeeding, they sleep off. They tell you they will sleep the whole day, and that is all coming from the pressure. Some are going to have convulsions. They will tell you, my child is epileptic. It's because of the pressure that is having. Depending on the level where you've gotten it, these children take long to gain milestones.
Let me ask you a question.
Yes.
By the time a mother hasn't noticed the fevers, before the head even starts to grow bigger, the mother has not noticed the change in behavior, the child being very irritable, and she starts now seeing the signs, the head becoming slightly bigger and stuff like that. At that point in time, can that condition be reversed? Is it too late at that point?
Like we shall see, in management of these conditions, the earlier the better. I'm not going to say to reverse, but earlier intervention is the best. Like I've told you, as the water is growing, there's pressure that is being impacted on the brain. The longer the pressure takes, the longer the effect. So a mother who has noticed the increase or the change in behavior for 2 weeks, the outcome after operation is way better than one who was noticed after 2 years. Yesterday we were operating on a child who came after 5 years. 5 years with the head growing bigger and bigger. It started at 8 months. He comes to the hospital at 5 years. It is different from one who has come at 2 months who noticed it 2 weeks ago.
So what you're saying is the condition is manageable.
Exactly.
If addressed at an early stage.
Yes.
But is there cure, 100% cure to this?
Cure is the intervention we do. It creates an alternative path for the water to move. Hydrocephalus means water is building up, but water is not moving. We all have that cerebrospinal fluid which is continuously moving in our heads. So the surgeries that we do is to create an alternative path. So when we create that alternative path, the water starts moving. Now, at the stage we pick it, it will determine the outcome. There are children that when you pick it early, you will never notice that they've ever had a problem.
They'll go back to normal.
They'll go back, they'll be with their slightly big head, but we all have different sizes. If they never tell you that they've ever suffered from hydrocephalus, you may never know. So the earlier the better. If you came after 2 years, it means the head will be growing every other day. When you come, we don't guarantee that the head will grow small because it has already, sometimes it has compensated in its big size. So when we operate, we just stop the increment. We don't, it doesn't reduce.
So you stop the increment of the fluid in the brain? The
increase in the size. Because every day our head makes cerebrospinal fluid 3 times in a day.
Right.
And we need a constant volume. A normal person has like around 150. The body makes around 450 to 500. So every other day the head changes 3 times that fluid. So every day it's producing, but if it's not moving, it has to create space.
Right.
Yes.
So you just create an extra pathway for that fluid to pass through.
When you get the alternative pathway, it means whatever is being produced, it will flow.
Okay.
There is a possibility that the head may slightly reduce in size, but we don't guarantee that it will grow to a size as if somebody has never been sick.
Wow.
Yes.
Wow. But at least there's treatment.
There's treatment.
Okay. And you actually told me that hydrocephalus can also be got by adults.
Yes.
Speak to us about that, because we just assume it's just the children that are at risk of this.
Yes. So like I said earlier, the greatest causative agent is infection.
Right.
But then there are some non-infectious processes that can give you hydrocephalus. Number one, there are people that get tumors in the brain. So a tumor can go in a space where the water flows from. So it means the cerebrospinal fluid is not flowing because of the tumor that is in the brain. Anyone can get a tumor, a child, an adult. So a tumor can give you hydrocephalus. Number two, you can get trauma on the head, like you get involved in an accident and blood flows and pours in those chambers that we've talked about, and it clots in there, it blocks the flow. So somebody can get hydrocephalus from trauma. Like I said, there are malformations that can happen. They can happen to, there are those that can manifest in life after. So the fluid builds up, and you get hydrocephalus. So people can get TB.
Yes.
TB of anyone can get TB. An adult can get TB.
Right.
It goes to your meninges. You get TBM. We call it TB meningitis. At the end of the day, you get hydrocephalus. So an adult can get hydrocephalus.
And if an adult gets it, I remember you telling me then it becomes a thin line between life and death, because for an adult the skull is already formed. Exactly. It's rigid, so there's no space for expansion. But if addressed early, at an early stage, on the onset, can it be reversed? Can we then get this adult back to normal life without having the risks of the head expanding and maybe risking even life?
So the problem with an adult, the head may not expand because it's now very thick and rigid.
Right.
It means an adult can easily die from hydrocephalus than a child. You don't have a lot of time for an adult because the head can't expand. As the fluid is expanding, it's pressing the brain to the bone, and there is no expansion whatsoever. So what kills, the signs they are going to look at, they're going to have constant, persistent headaches. They are always there, and they're going to be increasing in intensity every other day. Then they are going to have symptoms of pressure. They're going to be vomiting profusely, whether they've eaten or they've not eaten because of the pressure. They're going to be convulsing because of the pressure. They are going to have focal neurological complications. Because the brain is under pressure, whatever part of the brain is damaged, it manifests. If the part of the brain that helps you to walk is under pressure, somebody will stop walking. If the part of the brain that helps you to speak is then that's under pressure, they will stop talking. If it's a brain that helps you to hear, they will stop hearing.
So we actually need to stop assuming headaches and migraines.
Exactly. Very many patients adults have come to a hospital, and they tell you they've treated for malaria, they've treated for typhoid, brucellosis, and the full week.
But let me ask you a question. Is it the patient to blame or the doctors? Because most of the times you'll go, like you're saying, will be treated for malaria, many other things, but when it's too late, now they realize you had hydrocephalus.
Yes.
So how do you detect hydrocephalus in an adult?
You just need to have a high index of suspicion. Not every headache is malaria.
Right.
Not every headache is typhoid. Not every headache is brucellosis. I speak of those three because they're the commonest diagnoses they give people around hospitals. So you need to have, we call it history taking. When we are being trained in medical school, they tell us 90% of your diagnosis will come from the history. There are things that you look at and when you examine the patient, you realize that this patient has an increased intracranial pressure in the head. So those are the things that are going to tell you that probably this person doesn't have malaria, they have hydrocephalus.
Okay.
So it will come from your interaction with the patient, the questions you're going to ask them on your examination, and you have to know what you want to get anyway.
At times, do you go a step further to conduct brain scans, head scans?
Yes, routinely all our patients in our hospital, they all get CT scans. It is the gold standard to diagnose hydrocephalus. So every person, every child, every adult that comes that we're suspecting hydrocephalus, they get a CT scan.
Okay, let's speak about Spina Bifida.
Yes.
Is it reversible?
Unfortunately not. Spina Bifida, like I said, it's a defect that is happening in your backbone. There are different types. There are around 3-4 types. The first one is very mild. You have a defect in the bone, but the contents that run in the spinal in the canal are intact, so there is no problem. You can only get problems later if maybe your spinal cord gets stuck on one of the defects. As you grow, it gets stretched and you have symptoms. But the other one is when the contents that run in the canal, that is the spinal cord and its nerves, they come out in the defect. So unfortunately, whatever has happened, by that time it has happened. Whatever operations we do is to close the defect, to close the skin, such that no infection doesn't enter. We don't close the defect, it will remain there, and whatever nerve nerves that have gone through the defects, they are dead. Let me use that word. So there is nothing we can reverse. We just close to prevent infection from transcending to the brain, because we said there's a connection.
But the message is awareness. When mothers are pregnant, will it help for them to just stick to their folic acid supplements? Does it help?
We research has it that 70% of Spina Bifida cases they are from deficiency of folic acid. So we recommend folic acid pre-conception, because like I said, all this is happening in the first 1 month. Many of our mothers realize that they are pregnant after missing the first meeting the period, which is after a month. So we recommend, if you're intending to be pregnant or you are a lady of childbearing age, to start folic acid, that when you get pregnant you're already covered. By the time you realize that I'm pregnant, I have been taking folic acid for this long, so I'm very, very sure that my baby is safe.
Okay.
Yes.
All right. As we come to a close, your last remarks?
Like I said, this is more of awareness. So next week we are having what we call the World Spina Bifida and Hydrocephalus Day. It is on Thursday, on 25th. We're having celebrations in Gulu at Kenneth Kaunda Playground. We are there in partnership with the Ministry of Health and with the different organizations that are supporting these mothers and the children. We are going to see testimonies from mothers telling us what they go through. We're going to have testimonies from children telling us what they go through when they're in school, how they are coping out in public schools, in public hospitals. And we want to send a message to mothers, to government officials, that these two conditions can be prevented. In addition to being prevented, they can be treated. And the earlier the better. So we want to sensitize these people. We want to tell them we can reduce the burden, like you've told us. It is increasing. We can prevent it, we can treat it, and we want to appeal to the government, to policy makers, to pay attention to the disease. I think we are paying more attention to HIV and malaria, but also this is increasing. Yes.
Thank you so much, Dr. Noah Matagala from Cure Children's Hospital. It's a topic that we never speak of. So share this video, share. Even you as an adult can get this. So let's be sensitive, let's share this information, and let's stay safe. That has been it for Kickstarter segment. Morning at 10 TV still continues. Up next is Reality on the Ground with Andrew Chamagero. Keep it here.
Watching Morning at NTV.
50% bonus on data.
You mean if I buy 1 GB of data daily using Airtel Money, I get 500 MBs free?
Yes! 50% bonus on data recharges of Airtel Money.
Switch to Airtel Money to buy a data bundle and get 50% bonus back instantly.
Yes, 50% bonus back, valid till midnight of the validity period.
Dial *185*2# to get started. Airtel Money, simple, instant, secure. Airtel, the smartphone network.